These are the important things in history taking. So and also in this personal history is also major thing, that is personal history में veg and non-veg, sleep is adequate or not, addictions for example it can be a habits also, smoke, alcohol, tobacco and IV drug abuse, these are also come under the personal history. So in next one is family history. In family history mainly breast cancer, is there anybody is suffering with breast cancer, IHD and diabetes mellitus, schizophrenia and asthma, etc. So is any infection running in the family, it is also the major thing. For example, we asked only for past history, we are unaware of that it is going on at the exact time. We need to ask them, for example any TB patient is there, any leprosy patient is there, any cholera is going on, any typhoid. In case of epidemics it is helpful. So for the patient any allergy history is there or any immunization history is there, we need to ask them. So what is the socio-economic status of the person, because any malnutrition disease will be there. Kwashiorkor, marasmus kwashiorkor can be seen in the malnutrition. So another step is system review. So in system review, we saw the what are the systems and what are the questions we need to ask them. What are the systems reviews we can see in the patient history. So in general me we can see the weakness, fatigue, anorexia and change of weight, fever, chills, lumps, any abnormal swelling, night sweats, and in related to CVS cardiovascular system there will be some chest pains, paroxysmal nocturnal dyspnea, it meaning of this shortness of severe shortness of breath at night time and awakens the patient from sleep and relieved by sitting upright. It is called paroxysmal nocturnal dyspnea. So orthophonia, what is orthophonia is shortness of breath occur when lying flat and relieved by sitting or standing upright. And SOB, short of breath, cough, sputum will be pinkish or frank blood, swelling of ankle, it is the so many MI condition there will be swelling of ankle will be seen, and palpitation and cyanosis can also seen in CVS system. So related to GI, gastrointestinal, there will be appetite or weight change, diet, nausea, vomiting, regurgitation, heartburn, flatulence, difficulty in swallowing, abdominal pain, distension can be, change of bowel habits, hematemesis, melena, hematophagia. So hematemesis is vomiting of blood, melena is passage of black, tarry, foul smelling tools due to digested blood in the GIT, and hematophagia is bleeding in the rectum, and jaundice can also in GI. So in related to respiratory system, we can see cough may be productive or dry, sputum may be seen, it will color, amount, smell we need to ask, and hemoptysis means along with cough it will be blood also came sometimes. In chest pain also can see short of breathness, tachyphonia, abnormal increase of respiratory rate, hoarseness of voice, and wheezing can also seen in respiratory system. Related to urinary system, so what is the frequency of the urine? So is maybe any dysuria, and any urgency will be seen or not, or any hesitancy or terminal dribbling can be seen. Or terminal dribbling means it is the slow leakage of urine, and it is nocturia means It is in uncontrolled urination in night, bed bedridden, or back or loin pain. So incontinence, it means involuntary loss of urine, character of urine, color, amount, timing should ask, and also last in fever. So in nervous related system, we need to check for visuality, smell, taste, hearing, and speech problem is there or not. So for headache is there or not, any fits, faints, blackouts can be seen. So muscle weakness is seen, or any numbness, any paralysis of can be seen. We need to check for that, and any abnormal sensation, any tremors and change of behavior, we need to observe our in nervous system. And another one is genital. What are the genital uh, symptoms? So there will be a pain, discomfort, or itching, or maybe a discharging. Unusual bleeding can also be seen in some cases. Sexual history, so we need to ask for sexual history. And menstrual history, should ask. In menstrual history we need to ask for menarche, last menstrual period should ask, and duration, amount of cycle, and contraception should be asked. And obstetric history should be take, para gravida abortion should be taken. And last one is musculoskeletal system. In this pain, in muscle, bone, joint, any pain seen, or any swelling is seen, any weakness movement seen, so any deformities and any gait movement seen, we need to ask for the patient, or any check, we need to examine the patient for this. Thanks for watching the video. If you found this video as an insightful, share it with your friends and learn the history taking and become a master of history taking. Thank you.